Good afternoon, everyone. On behalf of the Education and Professional Development Committee, I would like to welcome you all to today's webinar entitled Pharmacists in Public Health, Lessons Learned, Learning, and Have Yet to Learn. We are thrilled to have Dr. Joy Snyder as our guest who will present. Now, Dr. Snyder is the Chief Pharmacist for the Monroe County Department of Public Health, a role which she launched during the COVID-19 pandemic. Her responsibilities include COVID-19 vaccine logistics and coordination, and assisting in the development and communication of local laws and community efforts. She completed her Doctor of Pharmacy and Master of Public Health degrees at St. John Fisher College, and also trained as a Public Health Pharmacy Fellow at St. John Fisher College in collaboration with the Monroe County Department of Public Health. Her hobbies include beekeeping, gardening, and traveling. Now, before we get started, I'd like to share a few quick points. So for those who have technological issues during the presentation, please use the chat option to communicate with the office. Every effort will be made to assist in the resolution. And now for those who have questions that you would like to direct towards the speaker, please use the question box or the chat option. And finally, the CE code for this program will be provided at the end of the program. Now with that, I'll open the floor to Dr. Snyder.
All right, thank you for that invitation and thank you for inviting me to speak this afternoon. I'm really happy to get to share information on what I've been doing and learning and what I hope to learn. So I am Joy and I am the Chief Pharmacist at the Monroe County Department of Public Health. And I hope that this talk is going to be kind of a low-key, informational, and most importantly, thought-provoking to all of our pharmacists on the call and future pharmacists. So just some housekeeping. I have nothing, no financial conflicts of interest to disclose. And these are my thoughts. At the end of this, I hope that you're able to recognize how pharmacy training prepares pharmacists for public health work, that you're going to be able to list areas in a local public health department that can utilize a pharmacist, to compare how public health work may look in different pharmacy models, for example, community, hospital, or ambulatory settings. And then explore ways that you can incorporate public health efforts into your work and or how you can become involved with public health departments or organizations around you. So just some background on myself so you know where I'm coming from. I have a full undergraduate degree in biochemistry from Rochester Institute of Technology. And with that degree, I also did 2 minors, one being deaf cultural studies and the other being business. Those do come into play later throughout my story. As was said earlier, I completed my pharmacy degree from Wegman School of Pharmacy at St. John Fisher College. And during that time, I was active with Phi Delta Chi. I had the opportunity to go on medical mission trips to El Salvador and Roatan, Honduras. And I'm pretty sure those experiences helped increase my interest in public health. And Fisher is also very focused on volunteer service. So becoming more engaged in our local community helped me to see what was going on in our local area and how public health and pharmacy can combine. I then completed a pharmacy residency, again with Wegman School of Pharmacy, and partnered with Wegmans Pharmacy. Continued on to my public health fellowship and masters of public health with Wegman School of Pharmacy. And I also, of course, worked with Monroe County Department of Public Health, as well as doing clinic hours at Anthony Jordan Health, which is a federal qualified health center here in Rochester. During that time, I was also a member of our MRC, which we'll get to talk a little bit about MRC later. And now my public health position as Chief Pharmacist of Monroe County Department of Public Health. I've been in this position since December of 2020, and it has been an exciting roller coaster of events while here. So to prepare for this talk, I first Googled public health pharmacist, and some hits came up. They were pretty cool. We'll go through some of them, but it's just interesting to see how Google hits perceive public health pharmacist, how website hits look at a public health pharmacist, and versus what I actually do and what others in the future may do. So none of these really fit my job particularly, but again, we'll go through some of the hits just to see what's out there for public health pharmacist. The first hit is the Commission Core of the U.S. Public Health Service. And I thought this was really interesting because it shows a lot of opportunities where pharmacists can work in a more national capacity. So working for the CDC, the FDA, the Indian Health Services, NIH, and a whole list of availability for pharmacists to work in these capacities. However, when we look at the definition that it says under pharmacist, it says pharmacists in the USPHS Commission Core go beyond routine pharmaceutical care, reviewing, approving, and monitoring new drugs, conducting groundbreaking drug research, and assisting in public health emergencies. A lot of this, to me, seems still very much a typical pharmacist activities, reviewing and approving and monitoring new drugs, a little bit of excitement if you're going to be able to approve new drugs, but it all seemed very what the world thinks of pharmacists at this time. So a little bit different than what I currently do. So we'll start off with lessons I've learned. And the biggest lesson and the theme throughout this section is that pharmacists are prepared. So we'll go to our first audience participation question, which is public health and population health are the same thing and are terms that should be used interchangeably. Is this true or false? All right, so we got a little bit of a mix. The majority say false, but some say true. So we will go over this. It is false. And why is it false? So public health is the science of protecting the safety and improving the health of the communities through education, policymaking, and research for disease and injury prevention. This goal is to promote and protect the health of people and the communities where they live, learn, work, and play. So essentially, the big picture is what we as a society do collectively to assure the conditions in which people can be healthy. On the other side, similarly, but there are differences, is population health. Population health is the health outcomes of a group of individuals, including the distribution of such outcomes within the group. It has a focus on understanding the conditions and factors that influence the health of populations over lifetimes. And it gives an opportunity for healthcare systems, agencies, and organizations to work together in order to improve the health outcomes of the community they serve. So public health, as a wrap up, public health is what we do to make people healthy, and population are what are the outcomes and how are outcomes affected. So it's kind of like that public health affects population health. And I just like to review this because a lot of times the terms are used interchangeably. I find myself using them interchangeably, but there are subtle differences for us to know when thinking about public health versus population health. And the 10 essential public health services are on this chart, but the big one, the big overall hierarchy is to protect and promote the health of all people in all communities. So we're going to go through each of these 10 essential public health services and think about how pharmacists are already doing these things or how we're prepared to do these things. So first, we're going to start in the top where it has assessment. So assess and monitor population health and investigate, diagnose, and address health hazards and root causes. So a lot of pharmacists right now are already assessing and monitoring population health, whether it's the folks that you're filling prescriptions for in an inpatient or outpatient setting. You can see what kind of health this population that you're serving has. Or is it in your ambulatory care clinic where you're checking blood glucoses of your patient and seeing, are they taking their medication? Are they having the good outcomes that you hope that they have? So we're already currently assessing and monitoring the population health. And the next one, of course, while we do not diagnose, I like to make that very clear, we can investigate and address health hazards and root causes. Why is my patient not taking their medication? Why are we not getting the outcomes that we would hope that this patient would have on this medication? So what is the root cause of their poor health or good health? We're currently doing that. Next, we have policy development. First, to communicate effectively, to inform and educate. I think this is one of the star points of pharmacists through our education with communications classes and being able to communicate to both patients at their level as well as providers and other healthcare professionals. We are able to inform and educate those that we are interacting with. Strengthen, support, and mobilize communities and partnerships. Again, no matter what your setting is, I know pharmacists are creating connections and partnerships with folks that are around them, whether it's a community pharmacy partnering with a business to do health screenings, or it's an ambulatory care clinic having a health fair to really connect with the local population. We're doing this kind of work. And then the last two in the policy development are to create, champion, and implement policies, plans, and laws, as well as utilize legal and regulatory actions. So we know that pharmacy does have a voice. It may not be as loud of a voice as we would sometimes like in the New York State, but we do have a voice that has helped to create, implement policies, plans, and laws. One highlight I think of is our ability to give vaccines and the continuous expansion of that law. And then utilizing legal and regulatory actions in our normal workday. Making sure that we are sticking to the law and that we are fulfilling our work to the highest capability. And then we have our section on assurance, which is enabling equitable access. And this one I see is making sure, a lot of times we work with our patients to make sure that they can get their medications. Is there a payment program that we can get our patient involved with, a copay assistance? How can we help our patients get access to the services that they need? A goal is to build a diverse and skilled workforce. I think, again, this comes back down to pharmacy school and making sure that we are having a diverse set of students and a diverse set of stories that make our workforce stronger because of its diversity. Improve and innovate through evaluation, research, and quality improvement. I know a lot of pharmacists do research and they're promoting their research, promoting how a pharmacist can implement change and the great health outcomes, going for that triple aim improvement. I know pharmacists are key to that work. And then building and maintaining a strong organizational infrastructure for public health. So again, this kind of comes back to what we as pharmacists are and the high standards that we set for ourselves. And we make sure that we continue to be an infrastructure to support public health for the long term. And public health occurs on different levels, one being our macro or large level, and the other being micro or small level. So in the macro level, it's more of a planning service. So focusing on the well-being of the population as a whole, emphasizing the assessment and prioritization of a community's health-related needs and planning to address those needs. So some examples of macro functions that pharmacists are involved in: to work with community representatives to identify health-related problems, setting the community health priorities, managing, administering, and evaluating community health promotion programs, and educating the community in ways that promote public health. And then micro is more of our implementation versus planning. So macro planning, micro implementation. And this is usually our one-to-one provider to patient or program to population basis, usually with a specific health-related outcome in mind. Some of those examples include disease screening, immunizations, counseling at-risk populations, as well as tobacco cessation programs. So our next audience participation question: have you ever done any one of the following of these? Have you counseled patients and their families on medications, decreased the use of broad spectrum antibiotics, talked with your patients about smoking cessation, given vaccines, talked with your patients about their diseases or how to manage them? Have you ever helped your patients find cost-effective drugs for their diagnoses? Have you ever called your patients post-hospital discharge to review their medication to decrease their chance of readmission? And have you ever lobbied for better health policies or expansion of services? Nice. A 96% yes. All right, this is exciting. So to all those who said yes, congratulations to you all. You do public health. And that's the point, I think, of this whole talk, is that whether we see it as public health, a lot of our actions currently are public health activities. So there's my Oprah moment. You get public health, you get public health, you get public health. When I'm giving a talk, I like to look into some historical things. And one of these papers that I found is from 1979, and it notes that pharmacists have been doing public health for a while. You're currently doing public health. And even back in 1979, this author notes that pharmacists are doing public health. And so one of the things from the article is that it will be argued here that some, but not nearly enough, pharmacists are now engaged in public health activities. Both the public and the profession of pharmacy benefit from public health pharmacists, but pharmacy education has failed to recognize the potential for pharmacists in public health, as well as to acquaint pharmacy students and practitioners with role models in public health. As we can see, that was in 1979. Now we're in 2022, and we have 96% of people saying that, yes, they've done one of those previous activities. And I'm sure there's other activities that I could have mentioned, but this article, I think, kind of shows the feeling that public health was going on, but perhaps we didn't have the correct infrastructure in pharmacy school to allow for an expansion of public health services. The author goes on to say that although bits and pieces of the elements required for training in pharmacy public health are present in most curricula, they're not recognized or presented as such. Just as the role of public health pharmacy gets lost in a set of roles, training in public health pharmacy, or just as the role of public health pharmacy gets lost in a set of roles, training in public health pharmacy gets lost in the traditional elements of the pharmacy curriculum. The author goes on to give suggestions on how do we remedy this situation. And he suggested that we should recognize that there are two levels where pharmacists need to participate in public health, being the macro and micro level, which we discussed those two things earlier. Second, to develop competency-based curricula in public health. Third, to support publication of a text that addresses the pharmacist's role in public health and the organization of healthcare. To modernize public health courses. And I thought it was interesting that the example was that students need to learn about Medicaid and HMOs and formularies more so than they need to learn about yellow fever epidemics. I find that slightly humorous because of what we just went through. Possibly still teach students about epidemics, but additionally, what is implementable and what is pertinent to current modern day medicine, especially looking at Medicaid and HMOs and such. Fifth, provide exposure of students to adequate role models. Sixth, explore innovative programs. So how can we make these like combination programs? And seven, strongly encourage an increase in the number of pharmacists who obtain the master's degree in public health so that they can act as role models at the macro level and develop logical roles for public health pharmacies at both the micro and macro levels. So what I do find promising about this is this article, again, I'll keep saying it, 1979, and how much times have changed. Especially I like to see that pharmacy schools are encouraging this dual degree. There was I would say more frequently the PharmD MBA dual degree, but now I do see more schools getting involved with the PharmD MPH dual degree, as well as addressing some of these other suggestions that the author had. So another audience participation question. An ACPE accredited pharmacy school and ACPE Accreditation Council for Pharmacy Education. Now a school, does it contain no courses that will prepare pharmacists for public health, contains only a few courses that will prepare pharmacists for public health, or has many courses that will prepare pharmacists for public health? All right, and we have a mixture of answers. Majority says contains only a few courses that will prepare a pharmacist for public health. Now, my questions so far, actually, none of them are actually evidence-based, but they're anecdotally based. And I would argue that the pharmacy curricula now has many courses that will prepare a pharmacist for public health. And I'll go through my reasoning, but the big reasoning that I have is that pharmacists, again, are already doing public health activities. So we just have to change our mindset to understand that our work is already public health focused. We just need to put a name to it. So these are some examples of pharmacy training requirements and their application to public health. Now, these are just ones that I remember from pharmacy school. I'm sure each one of you could individually take this and run with it in a different direction, whether it's a different course or a different individual experience. But I'm just going to go through these to discuss how I see that the current courses, some of them, the ones that I have listed, are applicable to public health. So pharmaceutics, how medications are developed, their expirations, their stability. I found this to be super important with my work with the COVID vaccines, knowing how vaccines were developed, how they work, and making sure that we were sticking to the expirations and understanding the stability. Why does this one have to be in a deep freezer? Why does this one have to be in a regular freezer? But it was very applicable to that portion of public health. Pharmacology, mechanism of actions and adverse drug actions, the interactions that they have with each other and therapeutic decisions. This can come into public health from a traditional perspective. I would say from like a public health perspective, we have STD clinics and making sure the medicines that we're giving to a patient are appropriate. But then from the flip side, when you're in a hospital and choosing the right antibiotic, you know how to limit therapy so that we're not causing resistance. Looking at epidemiology, I mean, this one speaks for itself. That's a huge portion of public health, and knowing why disease occurs and how much it is affecting our current population. Healthcare delivery, a huge one, looking at triple aim, reimbursement models, patient-centered care. This I find super helpful when talking with our local providers and local partners that don't always understand, well, why can this patient get certain treatment and this one can't? So having a good understanding of our healthcare system, and pharmacy school helps prepare for that. Diversity classes, so understanding the population around us. You can't connect with the population that you're working with if you're tunnel vision and you're not thinking about all of those that you could be impacting. Law courses, of course, looking at regulations, policies, diversion control. This becomes important when thinking about our current policies and how we can change policies. And public health is very dependent on policies, whether it's nicotine in cigarettes or what vaccines a pharmacist can give. We're very much dependent on the current regulations and how we impact the population. Communications, of course, is very key, making sure that we can talk to a provider at their level, a patient at their level, everyone in between, and pharmacy school prepares you for that. Population-based healthcare, I know we talked public health versus population health, but it's still very important. Looking at value-based care and social determinants of health is a huge hot topic right now. Looking at my county, Monroe County, we have inner city versus rural areas. And when thinking about the social determinants of health and our vaccination plan, how that impacted how we addressed each individual population. Huge. It was a very different model, how we went into the city versus how we went into rural communities. Evaluating medical literature. So whether that's statistics or looking at an article critically, this way you can, as a pharmacist, evaluate information and pass along that information to, again, other providers or your patients, and how you're going to allow that paper to change your practice or possibly not change your practice. But that is how it impacts the further public health efforts that you are doing. Management courses, whether it's pharmacy operations or communication, like with your team, very important to, I would say, all teams. And I make it specific to public health. When you're in a managerial role, how do you handle, let's see, conflict resolution or something? Ethics, resolving dilemmas in patient care, or using critical thinking to determine, getting back to our vaccination clinics, what's the most ethical way of distributing this vaccine? And then, of course, each school and institution has their own electives and clinical experiences. Some of the ones that I thought of, just again, from my own experiences, looking at teaching, research, and then specific medicine or specific areas of medicine, oncology, emergency medicine. At St. John Fisher College, we had a preparedness elective, which has come in really key because that was actually with the Monroe County Department of Public Health. Other electives, when folks take other languages, whether it's Spanish or American Sign Language, and being able to utilize that elective that they took and then impact the community that they're serving. At a lot of our vaccine clinics, I was actually our interpreter for the deaf population here in Rochester. That was because of my minor at RIT, but it was really helpful. And I really enjoyed it because I love actually getting to use my sign language, but it was helpful for the patients that came in who would have otherwise had to write down all their answers. So being able to utilize what you use in school and put it to practice in a public health way. And then finally, clinical experiences. All of these continue to build up our pharmacists to make them strong, well-rounded, and ready for public health experiences and public health work. All right, so we did lessons I learned. That pharmacists are ready, we're prepared. Pharmacy school is preparing pharmacists for this. So what am I currently learning? And the big lesson of this is that integration is key. At the Monroe County Department of Public Health, we have many different divisions. And my position here is more of a widespread across divisions rather than a siloed approach. So I am involved with our administration team. We have addiction services, early intervention, environmental health, epidemiology, our maternal and child health that covers a whole population and different aspects of that population. We have our medical examiner, our nursing services, and our preparedness team. And I would say that I have worked with all of these teams outside of really maternal and child health. And possibly we'll see roles for that in the future, but I've been able to work with each of these individual departments. And I'll go into a little bit of the work I've done with them. So current functions and projects, and that's where I was involved with the different divisions. So a big one, of course, being the COVID-19 efforts. When I was hired, it was our first day of giving COVID vaccines at the Monroe County Department of Public Health. And it was 2 feet on the ground, hit the ground running, coming up with the instructions and training modules on how to handle, dilute, draw up the vaccine, how we were going to store it, what our emergency plan was if, our ultra cold freezer broke. So that was probably spent the last year and 2 months really just in the thick of the COVID-19. Also with testing, we were doing both PCR and antigen testing at our locations. And again, from a pharmacist perspective, we are really good at reading information and then disseminating that. So when we got a new PCR machine, learning how to utilize that and then teaching others on how we were going to use it. And I forgot to mention our vaccine redistribution during our COVID-19 efforts. We were kind of a hub in our county for our primary care clinics and pediatric clinics, and folks who couldn't handle thousands of doses of vaccine at once, they would come to us to get vaccine. So making sure that they were handling it correctly. Sometimes they would have a question and they would call up, okay, well, I did this, what's this situation? And kind of almost being like a drug information researcher on the fly for them. And it helped build relationships with our county providers. And they really understood, oh, wow, pharmacists can do a bit more than I thought they could do at first. One of my favorite parts of the vaccine redistribution is when the pediatric vaccines started coming out and they had the manufacturing date rather than the expiration date, and how much confusion that caused. So just being there to be a support and be like, no, I read the paperwork. This is the manufacturing date. You don't have to worry that you're using expired vaccine. Another function of mine right now is working with our opioid epidemic. During COVID, of course, we were fighting a infectious pandemic, but of course, we always have the opioid epidemic going on. One thing that we have in Monroe County is Macy's Law. This is a local law that requires pharmacists to counsel on the availability of Narcan when a patient is picking up an opioid prescription. So I really wanted to call it normalized Narcan because there's such a stigma around Narcan use, and folks automatically have this idea in their head, oh, I don't need Narcan, I don't misuse or abuse my medications. But it's important to have Narcan available and easily accessible in the community. So the more that we can have that conversation with the patient and promote that, no, Narcan should be on everyone who has an opioid. So that's a local law that we implemented last year. It's hard to know the direct results because there's been other efforts to fight this epidemic, but I hope it's doing its positive work here. I'm also working with our impact team, which is improving addiction coordination team. Right now, we're trying to, again, address the opioid epidemic from an on the ground perspective. And I'm helping the team build a database so that we can follow our results and see how our efforts are going. Another function of mine is in pharmacy education. So currently, for all you students who are on there, we are putting together a public health pharmacy fellowship similar to what I did here at Monroe County Department of Public Health, and it will be with St. John Fisher College. Here's my little plug. We are currently accepting applications for this summer. So if you're about to graduate or you graduated last year and you're finishing up a PGY1, please reach out. We'd love to have more applicants. But with that fellowship, growing this ability, kind of that one function that the author of the article from 1979 talked about, let's get more pharmacists directly involved with public health. I hope to take students eventually as a preceptor, just got to work on the contracts with that. As a pharmacy liaison, I was in communication with our local pharmacies, with Macy's Law or other outreaches that we're hoping to do in the future. My position is a management position. So working, like I said, kind of widespread across the divisions, working with our environmental health team now and looking at wastewater surveillance, working with our special children's services. We're trying to implement a trauma-informed care program, and how do we make our care trauma-informed? So it's not directly pharmacy related, but it's still things because of the communication skills I've learned, the diversity skills. All of the pharmacy training can help us do more. And then as a pharmacy reference, this kind of ties back into vaccine redistribution when folks would call and have questions, or a lot of questions I get here in the department are surrounding naloxone or some of the medications we have at our STD or TB clinics, and just being a voice there that they can ask questions to. And I would like to also highlight on this slide that I would say, I believe my position is one of the only positions in a county health department. But this past weekend, I was at the New York State Public Health Association conference where a lot of the counties were present. And when they found out that Monroe County had a pharmacist, a lot of them were surprised and were, I would say, envious that they didn't have a pharmacist directly involved. So I encourage you all, if this is something that's interesting to you, please reach out to your local health departments, see how you can assist them. It might not be in a formal position, but being a resource for them, or if you're in a clinic aspect and you don't want to work directly for a local health department, still being a resource and a connection with them. Other positions that pharmacists have in local health departments are on their board of health. Each county has a board of health, and I have had some of the commissioners tell me that they have a pharmacist on their board of health, which they find useful. But yeah, pharmacists can do a lot. So maybe you find an availability to do a co-funding with a pharmacy school, or you find an ability to partner with 2 counties so that they can support you as a pharmacist. So I take this time to encourage you to make the connections, stay connected, sell your skills, and keep learning about public health and about how you can work with a local health department or in public health aspects. So some ideas that I have for the future for my position here, working with our STD clinic more, We have increasing rate of syphilis and other STDs. And so making sure that we're using first line treatment for those, possibly increasing the amount of vaccines that are offered through our vaccination clinic. We're again working with the opioid epidemic, whether we'll see where that goes. And then environmental health, like I mentioned, possibly looking into wastewater or drinking water surveillance. And so lessons I have yet to learn. This is what I don't know yet, but a call to action. So a lot of national organizations have already noticed that pharmacists can do this work and are excited about it. So I know we have ASHP. And so ASHP, the American Society of Health System Pharmacists, they have their own statement on the role of health system pharmacists in public health. This was published last year in 2021. And they believe that all health system pharmacists have a responsibility to participate in global, national, state, regional, and institutional efforts to promote public health and to integrate the goals of those initiatives into their practices. Furthermore, health system pharmacists have a responsibility to work with public health planners to ensure their involvement in public health policy decision-making and in the planning, development, and implementation of public health efforts, with the primary objectives to increase awareness of health system pharmacists' contributions to public health, educate pharmacists about public health and their role in promoting public health, describe the role of health system pharmacists in public health planning and promotion, and identify new opportunity for health system pharmacists' involvement in future public health initiatives. So one thing I like to highlight on this one is to educate pharmacists about public health and their role in promoting health. And I think pharmacists are doing that, are doing public health. It's just educating pharmacists on how they're doing public health, putting a name to it, putting a direction to it. And that's kind of one of my themes is we are doing public health. It just might be that you don't realize that you're doing public health. And how can we take all of our forces and move with momentum towards the same directions and goals? And then we in the pharmacy world have APHA, but then the Public Health Association or Public Health world has their APHA, which is American Public Health Association. So their APHA, the big public health group, says that actually has a role of the pharmacist in public health. They say that there are many functions of public health that can benefit from pharmacists' unique expertise that may include pharmacotherapy, access to care, and prevention services. Apart from dispensing medicine, pharmacists have proven to be an accessible resource for health and medication information. The pharmacist's centralized placement in the community and clinical expertise are invaluable. And then they continue, and I mean, this was a very long statement, so I only took bits and pieces, but they continue and say, the expertise of the pharmacist is not isolated to the education of the immediate community, but can also be utilized to inform laws and regulations. So the public health world does recognize that pharmacists are doing public health and that we are integral to this work. Now, I do want to note that this policy statement was written in 2006. I think it could use some updating. Some of the other examples that they share, I would say, are more of the modern pharmacists, working with disease screening or antibiotic prescriptions. But it's nice that they recognize us. Another national organization from the health perspective or public health perspective is NACCHO, which is the National Association of County and City Health Officials. And they had a statement from 2014 where they were promoting local health department and pharmacy partnerships for enhancing medication dispensing during emergencies. Now, of course, this is very specific to kind of that point of dispensing model, almost what we saw, similar to what we saw, I should say, during the COVID-19 pandemic, but leverage existing community partnerships, build mutually beneficial partnerships, and understand the legal frameworks. So this national organization is encouraging the local health departments to partner with our pharmacy partners and making sure that we are leveraging these partnerships and that they're mutually beneficial. So for example, if CLIA was passed in New York, could the local health department partner with pharmacy services for more STD screening or infectious disease screening, chronic disease screening? Additionally, some local health departments may be open to partnering with pharmacies for standing orders, whether you're an independent or a large pharmacy, reach out to your local health department to see what kind of mutually beneficial partnership can be built. So using the support of these national organizations, what are some of the actions that we as pharmacists can take? Of course, like I just said, partner with public health departments, expand public health in the pharmacy curricula, which is being done. We know ACPE has promoted rules for this, but continue to do that. Encourage hands-on public health learning. So whether that's through a traditional MPH or as pharmacy preceptors in more of a public health role. Advocacy, we know the importance of advocacy, especially here in New York. And then participate in state and national public health associations. So like I said, I went to the NISPA, New York State Public Health Association conference, and it was a really cool experience. I was the only pharmacist there. But I would say other counties are now, interested in getting more pharmacist involvement. And some roles that we can take. Now, there is not a big enough slide that I could put all these roles into. The roles could go on for days. Just use your imagination and see how does your work or how can a future role that you have participate and add to our public health. So I'll go through some of these. I know we're almost up on time. So safe drug prescribing, high cost drug analysis, of course, patient care. I mean, you can go 50 different ways with patient care. Emergency response. If there is a point of dispensing pop-up, how can you as a pharmacist help? Pharmacy operations and supply chain management. That became a big thing during COVID when certain prescriptions were getting used in a greater quantity than they should be used. So how can we help with the supply chain management? Infection and prevention control and administering antivirals and medication disposal through communication information. These roles could go on for a while. This is just some of the ideas. And if you can't think of a specific role, I encourage you to look at Healthy People 2030. So Healthy People is a program that sets data-driven national objectives to improve health and well-being over the next decade. And it breaks down into core objectives and different kind of objectives, along with these in the green, the leading health indicators. So the Healthy People 2030 leading health indicators, there's a lot of them, and I'm highlighting a few of them on where I see pharmacists could be helpful. So whether it's helping with decreased drug overdose deaths or decreasing exposure to unhealthy air, I tie that into tobacco cessation, vaccinating against seasonal influenza, help screening for HIV status, or help folks get medical insurance. In the children and adolescents section, it says adolescents with major depressive episodes who receive treatment. So do you work in a clinic where you can impact that? Is it a PHQ-9 screening, and do they need help with their treatment algorithm? Decreasing use of tobacco products among adolescents. And then in the adults and older adults, looking to help adults who meet current minimum guidelines for aerobic physical activity and muscle strengthening activity. While I realize that we're not all exercise scientists and nutritionists, I do believe that with a lot of the diabetes specifically training, you get an idea of how you can encourage patients to meet those minimum guidelines. Help patients with hypertension to get their blood pressure under control, decrease cigarette smoking, and then help decrease the amount of diagnosed diabetes in the population. I'm flying through this, but these are just some of the leading health indicators and how I could see pharmacists impacting them in the future. So if you're looking for a cool website to look through and what our goals of the population are, go to Healthy People 2030 and see where you see your work impacting one of these. All right, last audience participation question. When talking about my local MRC or Medical Reserve Corps, I know what the MRC is. I know what the MRC, and I'm involved in my local region. I have no idea what the MRC is, or I have no idea what the MRC is, but please tell me more. All right. So, okay, all right, I'm glad that the majority is, I have no idea, but please tell me more. That's exciting. All right. So the MRC is the Medical Reserve Corps, and this was established in 2002. It is a program for medical, public health, and other volunteers interested in public health preparedness. And this slide is very busy, but they had such a good graphic that I couldn't duplicate it. And it's just, I wanted to tell you about the MRC. So a lot of communities have an MRC to allow lay people, professionals, health professionals to help volunteer when a situation comes up. So some of the things that the MRC has utilized or has been utilized for are natural disasters, whether it's a hurricane or floods, outbreaks, so during H1N1 and Ebola, and of course, most recently, COVID-19. And then human interest, I thought that one was really interesting because I didn't know the MRC was involved with it, but when the Pope visited in 2015, the MRC volunteers helped support efforts during that time, and other volunteer responses that are necessary for the population. So the MRC, go to the next slide. There we go. So there are lots of communities served by MRC units, with the majority of our large communities having an MRC associated with them. And the average number of volunteers is increasing. I believe that has to do with COVID-19 and its impact and highlight on the Medical Reserve Corps. And 84% of all of the MRC response or units had responded, of course, during COVID-19. And so the MRC units, 89% of them had medical pod or mass vaccination plans prior to COVID-19. So these are units that were ready to have a point of dispensing, whether it was for medications or vaccinations. They were able to set that up quickly because they had previous responses and plans for that kind of outreach. And they also had non-medical pods available. And so what I like to point out is that the disciplines held by unit volunteers, there are pharmacists on this. We are severely much lower than EMS, nurses, or other public health or healthcare medical roles, but we do have a percentage of the stake in this, but I would like to see that our stake go up because pharmacists can be really integral in these units. Some MRCs are coordinated by their local health department. Some are freestanding, but I do have along the right side of this page is the website that you can click. It's the Serve New York website where you can sign up to be a volunteer in your area. And what happens with the MRC is when they have something come up or when they're going to initiate their efforts, they would give you a call based on your ability to serve. So they're like, okay, well, we want to bring in pharmacists and nurses and other people in for this. So they would be able to filter out what it is that you do, what it is that you offer. And then they would reach out to see if you were able to help. So I encourage everyone to check that out, see if you want to sign up for your local MRC through Serve New York. Okay, so the takeaway, pharmacists are prepared for public health. We have the training for it. We've been doing it. We continue to do it. We need to name it because, again, pharmacists are already doing public health work. And it's just shining a spotlight. Like, this is a service I currently offer, and this is how it relates to public health. And what activities or roles can you focus on to continue to expand your public health offerings? Is there something that you're currently doing that you could see on a larger scale? Is there somebody that you can partner with to make it bigger? Is there a local health department that you could see yourself working with to decrease some kind of, chronic disease or infectious disease rate? So the sky's the limit here. There's so many opportunities for pharmacists to be involved with this. We already are doing it, but how can we further grow this and make it bigger? So thank you all for listening. I will take any questions at this time. And I did have my email here if there's any questions, whether it's about the fellowship, my work in general, please feel free to reach out. I love hearing from people around the state.
Thank you so much, Dr. Snyder. That was a wonderful and illuminating presentation. So I will I'll start off with our first question. It looks like one of our participants, they already have an MPH and they're interested in the fellowship program. Could you talk a little bit more about the eligibility for it? Is it only for newly graduated or recently graduated pharmacists?
This is the first time we're doing it. We are very open to anyone who would like to apply. Some of the prereqs do include being licensed in the state of New York, and then an interest in public health. That's pretty much the qualifications as I can recall. So if you want to email me, and I can send you the link to our application so you can learn more. But yeah, we are open to whoever wants to apply. There's no required first year residency or a recent graduate. That's not a requirement.
Great. Now, I was wondering, what are some challenges you face while integrating yourself into the Monroe County Department of Health? Had they had a pharmacist previously?
They had not. I was their first. So challenges, I would say one is getting people to understand what we as pharmacists can do. Again, it kind of goes to this traditional role that people think pharmacists are, that person behind the counter counting pills, or that person who's checking prescriptions in the hospital. But we bring such a larger skill set to that. And I think making people, or helping them to understand, this is the training we went through. We can evaluate medical literature, we can do research, we can analyze these statistics. And so once you jump on a lot of projects, that's what really helped me. Something would come up and I'd offer, yeah, I want to be a part of that, let me in. So they could see what a pharmacist can do outside of that traditional thought process that people have about pharmacists. Additionally, because I went in during a pandemic, it was difficult because a lot of people were remote, or we were concentrated in COVID-19 related areas. I'm still learning a lot about what our department roles are and what we offer.
Thank you for sharing that. I definitely understand how you really have to prove how your training and your different skill sets apply in so many areas. Our next question is more about your thoughts on whether obtaining a master's in public health versus getting a doctorate in public health. Is there a difference for one's career in public health?
That is a great question. My initial thoughts, and of course this would be my opinion, and my initial thoughts is that because this talk is mainly headed for pharmacists, if you have a PharmD and an MPH, that is sufficient. Now, if you want to be more involved on a larger scale research base, if you want to get to the FDA, the CDC, perhaps a doctor of public health would help you. But I think with your training and a doctor of pharmacy along with an MPH, that would be sufficient for most doors in public health at this point. Having the doctor of public health, you would do more research during your training because you would be required to get that a large dissertation and presentation and such. But my initial thoughts is that an MPH plus a PharmD is more than sufficient for the majority of the roles. But of course, sky's the limit. And if you want to go for another doctorate, then yes, do it. Learn more.
I love it. And so the last question, once again, thank you for listing several organizations and suggestions for our viewers so they can get involved in their local public health efforts. Do you have any other suggestions on how we can advocate for further pharmacist involvement in different areas?
Yeah, I think for me, I've found that a lot of it has to do with networking, because people don't know, it comes down to people don't know what they don't know. So if they don't know what pharmacists can offer, we can't hold it against them. So it's making those connections with people that aren't in pharmacy, so you can show, well, this is what a pharmacist can do. Even when I was at my conference this past weekend, speaking with some of the commissioners, they didn't think of pharmacy from that perspective. They think about it as community pharmacists, works with patients there. They do recognize that community pharmacists are highly accessible and imperative to our community health because they are the most accessible healthcare provider. But thinking about how they would utilize a pharmacist in a different aspect, in a different way in the health department, you have to tell them. So my big thing is network, make connections with people who aren't pharmacists. So you can prove this is what I could do in this sector, or this is how I could bring benefit to your XYZ group.
Thank you. Let's see, I think that was, well, those are the last of our questions. So with that, I guess I can close here. Thank you again so much, Dr. Snyder, for today's webinar.